Welcome back to MedSynapse podcast. Today we'll continue invading a new medical condition related to skin health. It's a pleasure to announce about our guest. She will be our guide in this adventure, Icthyosis. Welcome, Dr. Akreti, on board.
Thank you so much for having me.
Thank you and your time and your continuous support. Firstly, Dr. Akriti, we will start from introduction about ichthyosis. So, what is ichthyosis and how does it affect the skin?
Icthyosis, as the name suggests, means fish-like. This in Greek means fish. So these are fish-like scales over the body. That means this is excessively dry skin, which is a genetic condition. It has thickened, scaly skin all over the hands and legs.
Great. So, Dr. Akriti, what are the different types of ichthyosis and how do they vary in severity?
The different types now, there are I think more than 20 to 25 types of ichthyosis, and they vary in various forms in the organ involvement, and they are genetically linked. So the most common type we call it as Icthyosis vulgaris, which can be very easily passed on as normal dry skin, versus the most severe and the life-threatening type called as harlequin type or laminar ichthyosis. So there are many types, many variations, many internal organ involvement, and from a very mild to a very severe form of skin involvement also, to the extent that it can be life-threatening and a person can die of ichthyosis as well.
Great. So, Dr. Akrit, there are a lot of types or maybe different genetics for this medical condition or infective agent. So, what about the genetic causes? What are the genetic causes of ichthyosis and how are they inherited?
Genetically, if I go into depth, there could be autosomal dominant or X-linked recessive or autosomal recessive. So there are many variations of which type of genetic disorder we have, and this can be diagnosed only via genetic testing, because the variation and the recessive or the dominant gene can be diagnosed only by that. The most common variant is like say X-linked recessive. So there will be certain specific features that we will see in certain common ones. There will be very thick features present in other ones, but very difficult to diagnose them clinically by saying which gene it is, because that has to happen in a lab via genetic testing only.
Great. Dr. Akriti, what about the environmental factor? Are there any environmental factors that can trigger or exacerbate ichthyosis?
Yes, in a way. See, it is a genetic disease. It is that means it is inherited, or family history should be positive in such cases. And to pinpoint, like I said, the genetic testing is very important. But over a period of time, if it is a very cold environment, then that can cause it. Some Native American or Asian races are common in getting it. So maybe it is some weather-induced condition that can induce it. If these patients are in very hot or humid climate, it can exacerbate because of that also. If they're in very cold climate, it can exacerbate because of that. If they have used any moisturizer or antiseptic, anything containing alcohol which dries the skin, that can cause the ichthyosis to pop up. So or any drugs, like any oral medication that they are taking which can dry the skin, can lead to more forms of ichthyosis. So yes, there are external factors as well.
Perfect. Dr. Akriti, in the following section, we will delve into symptoms and complications. So, from your clinical experience, what are the most common symptoms of ichthyosis and how can they affect a person's daily life?
Okay, so the most common symptom is dry skin. Now, when I say dry skin, it is not like a normal dry skin, but this is dry skin which appears like thick fish-like scales on the extensor aspects of the body, that is the more exposed aspects. So you will see dark brown color, thick diamond-shaped patches of skin which look like they have been stuck onto the skin. So it's like a scab which is stuck on. So it is unhealthy dead tissue of the skin which is sticking onto the underlying skin surface. Now this is the most common presenting symptom. This is on the extensor aspects. But if the same thing happens around the face or around the eyes, then you can see like it's like a I would say like a cellophane tape, like a tape is stuck onto it's that stretched. So it is stretched skin with more mucosa exposed, with excessive dryness on hands and feet, hands and legs. There is dystrophy of nails. There's loss of eyebrows, eyelash. Sometimes there's loss of hair on other body parts as well.
Oh, it's actually horrible. So, Dr. Akriti, can ichthyosis lead to any serious complication or more severe complication like infections or joint problems?
Infections, yes, because the skin is immature, unhealthy. So the chances of various skin infections are there. Yes, there are other several complications that can be involved along with the internal organs. Now, these are to be genetically linked and tested, but most of autosomal recessive ones do have some internal organ involvement. Joint pains in lamellar ichthyosis, there is so much contraction of the skin that we cannot extend the joint fully. So there is not full range of movement of the hands and legs or the toes, fingers. So the joints undergo resorption. So these joints are not used enough because they are contracted because of the skin, and because of not using, they sort of degenerate.
Great. So, Dr. Akriti, how is ichthyosis diagnosed and what tests or procedures might be involved?
The diagnosis, I mean, on biopsy, there will be a typical picture that we can see on histopathology. But the main thing is each type of inheritance has a specific feature. And by that feature, we sort of diagnose that which clinically, which category they may be belonging to. But sometimes there are breathing problems, there are infection, body temperature control issue, because if the skin is shedding so often and so much, then the temperature control or temperature regulation does not happen. All these things lead to the fact that we still have to do genetic testing. That genetic testing will happen in a specific genetic lab by taking the skin and giving it for protein analysis.
So, Dr. Akriti, it's very painful skin condition. So, it's time to know more details about treatment options. So, what are the most effective treatment options for ichthyosis and how do they work?
The most common one, that is Icthyosis vulgaris, that is a very mild variant. So we usually ask the patient to use emollients like moisturizer, keratolytic agents like ammonium lactate. We also ask them to use ceramides to stay indoor as much as possible so that excessive sunlight cannot trigger more issues. Apart from that, oral retinoids are the most common treatment options that are given. That is oral isotretinoin or acitretin. But while we take these medications, there's also the chances of dry eyes. Retinol also dries the skin. So it's a double-edged sword. And after taking a retinol drug, if we go in the sun, then that causes more skin damage as well. So we have to explain the patient that when you're on the therapy, sunscreen is important, sun protection is important, staying indoor as much as possible is important, trying to keep in a controlled environment with a humidifier is important so that the outside temperature does not cause any other issue. Now, these are problems related to the skin, but more often than not, these conditions are associated sometimes with heart conditions, sometimes with GI abnormalities, sometimes with intraventricular septum defect of the heart, mental disorders like autism or ADHD, or mood disorders in children. So, it is not just one thing which is the issue, that it is skin. There are many other aspects of the internal organs also that can be involved depending on the type of ichthyosis. So we have to combat all together.
Great. Dr. Akriti, you already mentioned a lot of aspects related to ichthyosis. So, how can ichthyosis impact personal life, self-esteem, and mental health?
Now, some forms of ichthyosis, like the Icthyosis vulgaris, which is a very mild variant, can lead a normal life and they just deal with dry skin. But the more severe variants, where there is already some brain involvement in terms of mental disorders or autism or ADHD, such individuals have a lot of mental issues related to it. They cannot socially be very open. They cannot roam around very easily in the open itself because of the skin condition. And not the, the people around them understand why they look like that, because some of them look quite gruesome as well. So it's very, very difficult for them to lead a normal life. And it's very difficult for normal people to accept people with ichthyosis as well, because the person looks like a fish, because the skin is so stretched and so scaly that the person looks also very different. So mentally it is very difficult for them.
Exactly, I totally agree with you. It's very harmful and may affect psychological factor as well. So, Dr. Akreti, what support and resources are available for individuals with ichthyosis and their families?
It's a very good question, actually. Frankly speaking, only hospitals or teaching colleges have some support system for such patients, because you cannot treat this patient in private setup or in isolation, because so many organs are involved together that we need multidisciplinary approach. And along with doctors, you also need a therapist, psychologist, for the patient to cope up with the condition, for the family to cope up with the condition. And since it is a genetic condition, a lot many members of the family inherit this sort of issue. So it's not a one-person counseling, it is a family counseling. It is also seen in people who have consanguineous marriage. So we try and explain them that it should not be, marriages should not happen within the first or second degree relative. We should look outside the relative zone for a potential prospect, so that this cycle can be, sort of reduced. And genetically, I mean, it's the teaching hospitals which have the best resource, because they have the lab for testing. They have the lab to tell you exactly which type it is, how is it inherited, and they have all aspects of medicine to help control it.
Exactly. So, Dr. Akriti, at the end of our episode, I need to thank you so much for your valuable insights and sharing, and make it valuable resource for all patients that suffer from ichthyosis. Thank you so much.
Thank you for having me.